Okay, that's in speaking to the leadership, speaking to the president. I think Lindsay and he are on speed dial. We've made the decision, since we don't have the votes, we will postpone that vote. Okay? And am I disappointed? Absolutely. It is a disappointment for myself. Just today, there is an eHealth.com report that the average family of three making $82,000 a year, 401% of federal poverty level, will be paying $29,000 per year for their policy, which means officially, according to the ACA, they cannot afford. That isn't just a few families. It is the average family of three making $82,000 a year. And when folks spoke that we didn't define affordability, well, the ACA has a definition for affordability, and no one can afford it. I'm also disappointed for state legislators, where we heard yesterday that Pennsylvania has a gap in their state legislature. News reports that Michigan will, Louisiana does. I can go down the list. We were going to give them relief. We will not be able to, and that's too bad for state legislatures. And lastly, is for those working families in non-expansion states like Texas, Utah, Maine, Virginia, Missouri, Georgia, Florida, South Carolina, Utah, I could go down the list, who right now don't have access to the dollars that would give them coverage. We are going to give them access. Access to the health care screens, the health care treatment that they otherwise will not have. I'm also disappointed for them. So those who will celebrate the fact that we won't have that vote just yet, think of those families of three making 401% of federal poverty level, those states, and those patients in those non-expansion states. As you celebrate, they are not celebrating, they are mourning. But we'll keep working at it. Our Democratic friends said if we just give them a chance, they'll now be bipartisan. They'll now have that chance to be bipartisan.